If you're struggling to get pregnant as a woman, there are some menstruation signs you might have been ignoring that may be the reason why you're not getting pregnant. And in today's video, we'll be talking about 5 period signs a woman should never ignore. And number one is cycle length more than 35 days. The normal cycle length should be between 21 to 35 days, counting from the first day of your period till the last day before another one. There are some women that does not see their period in 40 days, in 2 months. In fact, some women don't see their period at all in a year, while some only see it for a few times in a year. Are you still thinking PCOS is not real? Have you thought about hormonal imbalance? What about premature ovarian failure? Because all these and more can make your cycle length to be longer and thereby make it difficult for you to get pregnant. Number two is cycle length less than 21 days. You know, we said that the normal cycle length should be between 21 to 35 days. So if it is less than 21 days, it will be challenging for a woman that is trying to get pregnant. Personally, I have seen women who bleeds almost every 2 weeks. Yes, it's possible. After their 3 or 4 days menstrual bleeding, I mean, when they complete their menstruation for 3 or 4 days, they start bleeding again after a week or two. It will be very difficult for this type of women to get pregnant because even them cannot tell when they're ovulating and the right time to mess with their partner. You may want to go for an evaluation if your cycle length is less than 21 days. Number three is period more than 7 days. The normal period days should be between 2 to 7 days. And of course, there are women who bleed for more than 7 days. In fact, up to 2 weeks, some women are still bleeding. Not only the fact that this is very challenging to your fertility journey, it can also lead to anemia, that is low level of blood in your body, and that is another complication. Even if your bleeding is just 3 days or 2 days or even 4 days, but you notice it's heavier than normal or you're passing clots, I don't know why you're not worried. Are you not thinking about miscarriage? Because it can be a sign of miscarriage or even fibroid. That is why you need to go and evaluate yourself to know what is going on with you to optimize your chance of getting pregnant. And number four is late period. This one usually make me laugh because some women present with complaint like, doctor, their period is 2 days late, 3 days late, and they're worried. I would just be smiling and be like, can you just relax yourself? Why are you worried for a period that is just 2 or 3 days late? In fact, your period is not late if it's just for 2 days or 3 days. A period is said to be late when it is more than 5 days from the expected date. Okay, if you're supposed to see your period on the 15th and on the 20th, 21, your period has not come, then you can start getting worried. But if your period is 2, 3 days, or even 4 days late, it's okay because your diet, sudden weight gain, sudden weight loss, and chronic stress, all this can have a negative impact on your period and make it late for few days or even make your period comes earlier than normal. So do not be worried if your period is 2 to 3 days late, but start getting worried when it's more than 5 days. Number five is severe pains. There are some women who suddenly start experiencing chronic pains during their period, no matter the amount of painkillers or how strong is the painkiller. I mean, this pain is so severe that they can't even do anything once it starts. If you are experiencing this, but you still decide to stay at home and you're trying to get pregnant, first of all, are you not thinking about PID, pelvic inflammatory disease? Second of all, endometriosis, because that can cause pain too during your period. What about fibroid? Yes, fibroids can cause pain during your period. So, whether you're trying to get pregnant or you're not trying to get pregnant, as a woman, you should never ignore these period signs because they can impact your fertility journey negatively. I hope you find this video helpful. Thank you so much for watching. My name is Dr. Shakeerah Alex. I'm a fertility physician at Habim's Fertility and Andrology. I'll see you guys in my next video. Thank you.